Guys, let's discuss about classification of mental disorders. They are based on the international classification of diseases. Okay, in 10th edition they given this. Okay, organic mental disorders are delirium and dementia. Dementia means loss of memory, whereas delirium means irresistible thoughts. Okay, which are of increased energy. And mental and behavioral disorders due to psychoactive abuse, they are alcohol, cannabis and cocaine. Due to these substance abuse, the persons will suffer with some disorders. Okay. Schizophrenia, schizotypal and delusional disorders. Schizophrenia, the patient may have positive and negative symptoms. Positive symptoms are those normal individuals won't have. The schizophrenic persons, they have the additional behavior, that is positive symptoms. Negative symptoms means normal person will have but schizophrenic won't have, that is negative symptoms. And schizotypal, schizophrenia like thing is schizotypal. Persistent delusional disorders, continuous thoughts. Okay. Schizoaffective disorders. And mood disorders, we have bipolar affective disorders. Bipolar means two poles. The person may be either extremely happy or extremely sad, so it may alter, okay, in between. Maniac disorder, we know the drug used to treat the mania is lithium, and in some conditions we will use sodium valproate, which is anti-epileptic drug. And depressive disorders, persistent mood disorder, these are all of mood disorders. And another one is neurotic or stress related somatoform disorders. Due to stress we will have some disorders. Those are anxiety, phobias, fears. We will have OCD, obsessive compulsive disorder, dissociative disorder. The person may dissociate from his surroundings and he will be in his own world. Okay. Somatoform disorders, stress and adjustment disorders. Another one is behavioral syndromes associated with physiological, physical disturbances like eating disorders, sleeping disorders, sexual dysfunction. And adult personality and behavior disorders are personality disorders, impulse control disorder, gender and identity disorders. Mental retardation, another one is this may be mild, moderate, severe and profound mental retardation. Disorders of psychological development, this is there may be speech and language disorders and development disorders. The child cannot speak, it may be autism, or it may be belonging to psychiatry department, but we will mistaken and we will go and take the child to some ENT, and we will think there may be any developmental deformity in the child, and we will go to ENT, okay, department, but they will refer them to psychiatry department if there is no anatomical thing in the larynx. Okay. And language disorders also will be there, and developmental disorders will be there. So behavioral and emotional disorders of the childhood and adolescence, they may be hyperkinetic disorder, attention deficit disorder, conduct disorders and tic disorders, and some disorders may be unclassified. Okay, this is all of our classification of disorders. Okay. One is mental and behavioral disorders due to psychoactive abuse, schizophrenia, schizotypal and delusional disorders, mood disorders, neurotic, stress-related and somatoform disorders, behavioral syndromes with physiological, physical and disturbances. Okay. And adult personality behavioral disorders, mental retardation, disorders of psychological development, behavioral emotional disorders of childhood and adolescent, and some disorders are unclassified. Thank you guys.